COVID vaccine mandates were one of the most controversial issues related to the pandemic. Now there is CDC state level data that shows that states that had mandates did not increase their vaccine rates. However, it did have the unintended consequence of lowering booster shots in those states as well as flu shots. So let's talk about it. Hey everybody, it's Dr. David. It's good to be seen out there. As many of you know, I am a board-certified pediatrician here in Tampa, Florida, and I have been on the front lines of COVID, as well as the mandates, as well as the vaccines, and pretty much everything else related to COVID, but also health, infectious diseases, inflammation, etc. And so that's why I'm going to be talking about this today. I found this rather interesting. Now, I've also been one who has always been an advocate for medical choice. And that's true for both vaccines as well as reproductive health, as well as how people individually wish to be treated. There's almost always more than one option out there, even if there may be just one thing that's considered standard of care. But everybody has both the right as well as the responsibility as a parent to make the decision for their family or for themselves to decide what is best. And my philosophy is I've always been one to support a person's decisions, especially when they've been well thought out, and I'm there to help people make those decisions. But I don't make a lot of decisions for them. I'm able to provide guidance based upon what their choice is. Okay. Now, as far as what we're going to be talking today more about, we're going to be talking about in my initial presentations a little bit to the FDA authorization committee in the first place about the COVID vaccines. We're going to talk about unintended consequences that happen from lockdown and from the vaccines, and some new research, as I mentioned, relative to what vaccine rate outcomes happened as a result of states who had mandates relative to states that did not. Okay. Now, for those who don't know, we do post 2 weekly episodes similar to this, about 10, 12 minutes or so, that really gets into the beef of some issues. If you enjoy this, please do subscribe, share it with other people. We really want to make this, the information that we share, available to as many people as possible. And of course, that means feeding the algorithms. Now, as far as my FDA presentations, I was asked to present 3 times to the FDA, the Emergency Authorization Committee. Once when the Pfizer vaccine was being discussed, once when the Moderna vaccine was being discussed, and again once the vaccines were being introduced or to be introduced to children. And one of the things that I mainly focused on was imploring the FDA and then in the CDC to be transparent, to let people know what we do know, what we don't know, what we believe is a hunch, which we believe is fact. And of course, pretty much everything back then was based upon a hunch, no fault of anybody else's. But let's face it, there was no COVID to be research to be looked upon at the very beginning. Now, also, I wanted to just, again, be educating people so that they know what their options are and what they can do and what's best for them. Now, another thing that I also let them know, people don't like to be told what to do. People like to come to their conclusions. Most people, when a finger's being pointed at them and they told them, most people are going to back off. That's just, I think, a human nature thing to do for most people. Now, let's next talk about the unintended consequences from the lockdown as well as the mandates. Now, we've talked in the past, especially with children, the lockdown did have some pretty significant issues. Kids lost out on social skills. Kids lost out on classroom education time, learning how to take turns, those types sharing, because they were, if anything, they were behind a screen, right? They were being forced to do school through the lockdowns. And of course, I understand the reason why. At the time, we didn't know where this thing was going, how it was spreading. But there were other issues. Medical services as a whole were delayed. Some surgeries had to be delayed. People didn't have access to medical care because they couldn't find places that were open or couldn't get there. And another, I'm sure, unintended consequence was that overall, vaccine rates in children did decline, again, for those same reasons as to the other medical procedures. All right. Now, in terms of mandates, there were millions of people who were forced to get the COVID vaccine or risk losing their job if they didn't comply with the vaccine mandate. And that some people just left their jobs, moved out of states, etc. Certainly something that wasn't intended for the states who put these mandates into place, because they were losing their part of their workforce. And of course, one other thing which I'm sure wasn't really anticipated is that some states then went on and did a ban on mandates. So they refused to allow mandates to take place as well. Now let's talk about this new CDC research. So this is state level data. So this is data collected at the state, sent over to the CDC for that they can put some bigger picture eyes on this. And, it was done, and this particular paper was compiled by the Department of Communication at the University of Arizona, as well as the Department of Education from Furman University. And it's interesting, though, that these were papers that were done by the communication departments of these universities. And I think that is interesting, but also makes sense because, let's face it, the communication relative to COVID, all things, certainly was not ideal, and that may be a very generous way of putting it. But of course, when communication is knocked out, then all of the things in terms of the information they're trying to get out, it's not gonna be either accurate, it's not gonna be timely, or more than likely, it's not gonna reach the intended user, the listener. Okay, and so what they did in this is they compared the states that did have mandates for COVID vaccine versus states that did not. Now we've been talking about we know that there was federal mandates as well, but also on the state level, some states required all students to get vaccinated for COVID. Some states required all state employees or local employees to be mandated to get a COVID vaccine, and again, others did not. And so, what they were looking for is they were looking for changes in the uptake of COVID vaccine to start off with. So, were more people going to take the vaccine because there was a mandate in place? So, people who were not necessarily mandated, but whether they would respond, how they would react to seeing this mandate that's out there. But also relative to behaviors beyond that shot, in particular, looking at the number of people who took boosters for COVID, but also looking at people, both children and adults, who did the flu vaccine and comparing it, of course, also to before the mandates and in previous years. Now, there were 19 states who had a full mandate, and then that was compared to all the rest of them. Vaccine rates, first of all, were not statistically different in states that had the mandate versus those who didn't. So, for sure, the mandate did not inspire people to go out and get a COVID vaccine. Okay, and so that also suggests it just didn't really have an impact on people. They were going to do it, they were not going to, but having that mandate there did not inspire people to do it. Now, states that had the mandate in place, they had lower levels of the COVID booster adoption. Okay, so less people took a booster in states where there was a mandate. So again, whether that was more long-term messaging versus short-term messaging, they didn't really get into the details as to the why, but they said there were less boosters in states who had the mandates. Now, they're also, again, for both children and for adults, less likely in the states that had the mandate to get a flu vaccine. Okay, and then I'm sure there are other consequences as well, but for sure that wasn't the intention of states making the mandates is to have their vaccine numbers go down or to at least not go up from all of this. Now, what's my take overall on this? First of all, people usually respond in a negative way if they're forced to do something or if they hear people are forced to do something. People need to come to their own conclusions. People need the time and the space in order to get there, especially if they're going to be ostracized. They're going to be made as if they are unintelligent people, as if they're the scourge of society. Well, people aren't going to really respond well to that, and if anything, they're going to push back. And so, calling all those names and all those things that we were hearing about, it certainly didn't accomplish anything on this either. But again, people just want medical choice. They want to be given, this is choice A, this is choice B, this is what you have the opportunity to do. And if people choose to vaccinate back then as well as now, I support their decision. If they choose not to, I'm going to support their decision. The most important thing for me as a primary care doctor who works one-on-one with people, which is different than public health. I totally understand the CDC, state departments of health, federal FDC, the FDA. They are trying to put one word out there for the entire country. And of course, that's impossible to do because there's so many different segments, cultures, people as a whole out there, but they're having to take care of all of us at once. So they're going to be making decisions that any one person may not agree with, but they're trying to do it. And I do truly believe it's in their heart that they're trying to do the right thing for the most people. So whatever that takes, it does. Now, again, just another reminder, if you haven't, so that's my take, but please subscribe to this channel, pass the information along, share it with other people. Also, just to remind you that our Patreon, my subscribers for Patreon, they have access to my primary care protocols that are out there, as well as other little goodies that we don't put out elsewhere. So hopefully you can become a Patreon member as well. All right, have a nice day.